Hi, this is Dr. K from iMedicalSchool, and today we're going to talk about colorectal cancer screening. Please make sure to watch all our free educational videos on our YouTube channel, iMedicalSchool. If you like what you see, make sure to like, share, and subscribe. In 2018, more than 50,000 people died from colorectal cancer, with at least 100,000 new cases. What is even more breathtaking is that 1 in 24 will be diagnosed with colorectal cancer in their lifetime. Just think of how many people you know. Unfortunately, this is a very personal disease that will affect all of us in some way. Today we'll discuss some common questions about colorectal cancer screening. How are we doing in the fight against colorectal cancer? Awareness regarding colorectal cancer has led to a steady decline in the number of new colorectal cancer cases across the United States. The push to get more individuals screened has led to significant decline in colorectal cancer. Better understanding and education has allowed us to find colorectal cancer at earlier stages and improve survival. Though the overall number of colorectal cancer cases are decreasing, there are areas we still need to focus on. For example, we are seeing a surprising increase in the number of colorectal cancer cases in those from 20 to 49 years old. This new trend may be related to the obesity epidemic or another risk factor we have not yet identified. There have been great strides in colorectal cancer mortality and incidence among African Americans. Yet still, the rates of mortality related to colorectal cancer among African Americans are still higher than any other ethnicity. Though we have made great strides in combating colorectal cancer, it is more important than ever to identify those who are at higher risk of developing colorectal cancer and start screening sooner. What are the risk factors for colorectal cancer? Risk factors for colorectal cancer are split into lifestyle and family history. The greatest risk factors for colorectal cancer are alcohol, obesity, diabetes, and eating red meat. Given the rise in alcoholism, obesity, and diabetes over the past 10 years, we need to be more vigilant than ever in recognizing symptoms and signs of colorectal cancer, or we may lose the gains that have taken so long to achieve. How does my family history affect my risk for colorectal cancer? Family history plays a very important role in the development of colorectal cancer. If someone has a primary relative with colorectal cancer diagnosed prior to the age of 60, then we need to start colorectal cancer screening early. Start screening 10 years prior to the age the relative was diagnosed or age 40, whichever is younger. For example, if someone's father was diagnosed at the age of 55 with colon cancer, then start screening at the age of 40, not 45. Talking about our medical problems with our family can be uncomfortable, but knowing your family history could save your life or the life of one of your family members. So take the time and talk with your family. Those who are at average risk for colorectal cancer should start screening at the age of 50. Surprisingly, the American Cancer Society released guidelines this past year stating that those with average risk should start screening at 45 and not 50. Though this has not become standard of care, further research is needed to understand if screening at an earlier age is necessary to combat colon cancer. What are the main methods of screening for colorectal cancer? The main screening methods for colorectal cancer include stool tests or direct visualization tests. These stool tests include the guaiac fecal occult blood test, FOBT, the fecal immunochemical test, FIT, and the FIT DNA, Cologuard. All these tests are stool tests that detect microscopic blood in the stool as a marker that you may have colon cancer. The FIT DNA or Cologuard test not only detects blood, but also detects abnormal DNA. In fact, Cologuard is better at detecting possible colorectal cancer than FIT testing alone. In addition, Cologuard is better at detecting advanced precancerous lesions, polyps that are closer to becoming colorectal cancer, than FIT testing. The downside with Cologuard is that it can be too sensitive and does result in more false positives than FIT testing. In addition, Cologuard testing is more expensive than FIT testing. In one study in the New England Journal of Medicine, colonoscopy detected 65 colon cancers and 757 advanced precancerous lesions. Cologuard was only positive in 60 of the 65 cases of colorectal cancer and 321 of the 757 advanced precancerous lesions. That means 5 people, or 8% of people who had cancer, and 436 people who had advanced precancerous lesions would have been missed if they did Cologuard only instead of colonoscopy. That doesn't mean Cologuard is a bad test, but we do need to understand the limitations of these tests. Colonoscopy remains the best screening method and the only screening method that decreases the risk of colorectal cancer. What is a colonoscopy? Colonoscopy is a method where a flexible fiber optic tube is maneuvered through the colon looking for abnormal precancerous tissue called polyps and colon cancer. To perform a colonoscopy, the person undergoing the procedure has to go through a bowel prep so that during the procedure, the entire colon can be examined to look for precancerous tissue called polyps. The bowel prep is the toughest part of a colonoscopy, but given it is the only test that actually prevents colon cancer, it is well worth it. Many people who are scared of colonoscopies have heard of complications during colonoscopy and as a result do not want to undergo colonoscopy. The risk of a major complication with a colonoscopy is low, and you're 100 times more likely to be involved in a car accident than to have a major complication with a colonoscopy. So talk to your healthcare provider about receiving a colonoscopy. In the end, colorectal cancer screening is important, and it does not matter which test you choose, but figure out your risk and get screened.